Okay, then. So let's get rid of that. And welcome everyone to the COVIDcast October update. And thank you again for joining us. Tonight we have my co-host Terry Munt, and we will be going through a few topics related to the recent news of surges, both in Europe and the United States, some of the drivers that are affecting the increase in case counts across the Midwest, and how they are going to likely affect the rest of the nation over the next 2 months. As I said before, we have been doing this COVIDcast as a sharing of information from professional community that I'm tied into, of biomedical scientists and physicians. So I do the weekly research. I was doing the weekly research and doing a weekly broadcast of this on Facebook Live, as well as the Zoom meetings, for 6 solid months on a weekly basis. And Terry was with me every single week, assisting me with the technical, and the promotion was John Daw. And of course, we have Karen, our friend in Wisconsin, who has a long history of healthcare activism, also assisting in the gathering of the topics and questions both before and during the broadcast. So to cover some basics, of course, use the chat. We were in a webinar format before, but now we're just going to go with this format. Use the chat for any questions that you might have. Interrupt us as we're going along here, and if I'm in a presenting some information, and Terry will catch me up by monitoring the chat log and stop me when any questions come up that are relevant to the topic at hand. I hope that we can keep this conversational and make sure that all of your questions that you may have accrued over the last month since we last met can be answered tonight. And if we cannot, then I urge you to continue to use the resource page, which is at fb.com/Sanjay Udoshi, all lowercase, one word. And you will find updated articles, and you can access our biomedical group page, which is kind of the people who are more interested in the technical research aspects of COVID, as well, by requesting group access there. But it is freely available for everyone to look at the videos that we put up there on a almost day-to-day basis from experts across the world, and who are focused on disseminating novel biomedical discovery regarding treatment, vaccines, trends, and the effect of COVID on communities and nations. So we've tried to keep you all abreast of all of those developments using the resource page. And as I said, we're now committed to doing 10 of these monthly COVID updates. This is our second one. The first one was in September. This is again our October update, and we're going to try to keep this focused on what we've learned since the last update, and what to be aware of in the month ahead, or the couple of months ahead before the end of the year. So with that, let me just start up our presentation. As I always do, urge you to use any of these resources. We have an entire archive of the webinars and presentations on youtube.com/smudoshi. You can get into the group page using that bit.ly. That's the technical resource page with all of the scientific papers and that get updated from the preprint libraries across the medRxiv, PubMed, and other publications. And then, of course, available to everybody is fb.com. I always take a moment to recognize that this is an incredibly difficult time on everybody's mental health. I personally have been affected by members of my family having issues with mental health that have resulted in suicidal ideation or suicide. And it's important that you let people know that there's help out there. If you can't reach out to them personally and they are reticent to talk to you for whatever reason, please guide them to the 800 number for the National Suicide Hotline, or other resources in your community that might be useful to them. So tonight we are talking about either what could be described as the third outbreak or the second wave in the United States. Now, this is arguable, and I'm sure some of you have opinions that I'm hopeful you'll share with us, but what we're talking about right now is a massive surge in the number of daily cases being recorded in the United States. We all know that the data gathering apparatus in the US has gone through various stages of inaccuracy and unreliability. And much of that has been actually, in the initial part, driven by the fact that we were entirely unprepared and were probably suffering from a lack of appropriate leadership when it came to, pandemic response. Now we are actually seeing something much more nefarious, which is the actions of political leaders that are interfering with the data dissemination process, not only the data gathering, but also reporting accurately on what's happening where. And so we have some examples of leadership that has tried to become better at this over the last 3 to 6 months, and leadership that has arguably become much, much worse at it. And so I'll let that out there right now. If you live in Texas or Florida or Georgia, none of the numbers that are being reported are accurate. And they are also not timely. So there's apparently a documentary being done, soon to be released by a Florida data scientist that is outlining and detailing all of the reasons why the Florida government's, the Florida state government's reporting and numbers cannot be trusted. And the, I guess, decidedly deliberate attempt to obscure data on schools and the attack rate in schools as well as among children, under the age of 18 in public schools, and what that actually may mean to communities when those are forming new niduses of infection. If you live in Pennsylvania, New York, parts of California, and Pacific Northwest, Washington State, and luckily most of New England, Vermont, Massachusetts, Maine, those state governments can be applauded for actually getting better at this over the last 3 to 6 months than the rest of the country. And so that being said, we saw an initial wave. That initial wave was never truly addressed. And as a result of it not being addressed, we only reduced our daily incidence rate to around 18 to 20,000 cases reported. And then right after the 30th of June, we saw a massive southern surge. And that was, in accordance with the latency period of people returning to, routines of going out to eat, going to bars, going to large gatherings, Memorial Weekend and all that stuff. And we were seeing case counts as high as 65 to 70,000 a day across the South. But nationally driven by the South, but across the country, 65 to 70,000 cases a day. And that also came down towards the end of August and into September. At the time of our September update, the southern surge had dissipated. And that was a result of the education of those communities and also the requisite shutdowns of large events and gatherings, um, to try and bring those numbers down. But they never returned to 18 to 20,000 cases a day. They leveled out at about 40 to 45,000 cases a day for a period of about 3 weeks. And into mid-September, I'm sorry, mid to late September, these case counts in various locales started to rise again, most notably in the Midwest. So what we're seeing right now in the Midwest across basically the hotspot being Wisconsin, but also Minnesota, which was largely, also a heavily affected area, Illinois, Iowa, Arkansas, all of these states, Missouri, are seeing a Midwest surge. And so these are adding to the numbers that could be described as the third outbreak on our first wave in the United States. Or, as Terry mentioned when we were talking about it, I guess, I don't know if we were talking about it in a thread or last time we were speaking, that in fact, this is, you can have a second wave without the first wave having been contained. Okay?
Especially when you don't manage the first wave,
Right.
you just let it
Right.
go for 6 months.
Right.
Yeah.
Exactly. So this is a very unique picture. It's a unique picture for the United States and in the United States compared to the rest of the world, where there was a definitive first wave, a reduction to baseline, and a climb back up to a second wave. So this is an overlapping wave, very unique to the United States, and as a result of the lack of leadership in the pandemic response. Okay, so there's some information that I'd like to share with you specifically about women and post-COVID. I mentioned this last time when we talked about women being about 60% of those who suffer post-COVID and men being about 40%. That number is closer now to 70-30. So 70% of women are the ones suffering from long COVID and 30% are men. And that number indeed is being investigated from the perspective of both vascular damage and autoimmune response. So as you remember, in the early part of the first wave in New York, there were a number of children who displayed a disorder of their immune system after they had recovered from COVID. And it was actually the disorder that had been the cause of their deaths in a few of those cases in children. A different version of an autoimmune response is what is most likely affecting these women with long COVID. And we're also seeing certain blood levels, blood biomarkers, as we call them, being very indicative of this. So it's not just what we've talked about before, like the D-dimer as an indication of microclotting, coagulopathy, or CRP as a indicator of disseminated inflammation and cytokine, post-cytokine storm and things like that. But we're also seeing anti-nuclear antibodies. Anti-nuclear antibodies are elevated in conditions like lupus. So systemic lupus erythematosus is its technical name. Lupus is its common name. Is a disorder where the body produces antibodies against its own tissues, and the result of that is a multisystemic, a debilitating condition. And we are beginning to see that some women, and in fact, the reason we're not seeing enough data on this is because the discovery is so new. It's only been in the literature or in the news for the last 3 to 4 weeks that doctors are taking the extra step of doing anti-dsDNA, which is ANA, which is the anti-nuclear antibody assays, which are typically used in rheumatoid arthritis, in rheumatic rheumatological patients, to determine their prognosis, as well as initially in their diagnostic phase. So what does this mean? It means that the virus is triggering something after it has left, after the infectious condition has, or what we call the viral syndrome has ended. And shortly after that phase is over, what we call the acute phase, the chronic COVID sequelae begin. And we'll talk about the numbers there. Terry, if I go off track as usual, bring me back to talk about this topic. Of course, in the news recently is the attack on Dr. Fauci, the attack on science and medicine from the current administration, and what that means to the institutions on which public health relies in this country. That means the National Institute of Health, the CDC, the FDA, the organizations within Centers for Medicare, and the entire administration of care for our elderly. This is a far-reaching and highly, highly dangerous trend. One of the problems with the president coming out and saying things like this is because he has developed a cult of personality around him, and that cult readily and immediately parrots exactly what he says. And so they begin to believe things that are patently false, that are demonstrably false, and it doesn't matter. After that, trying to convince them of otherwise becomes nearly impossible. And we have our resident expert on that, David, with us.
Hey, Sanjay,
Yeah.
I'd just like to point out we had a conversation, I think it was about 3 months ago, where I thought there was a deliberate direction being taken towards herd immunity. And
Yes.
now that they're not listening to most of the COVID task force, and they're keying up on Dr. Atlas, I
Yeah.
think his name is, who
Correct.
is a what is he?
He's a neuroradiologist. So
And his experience in viruses and
is
would
zero.
be zero.
Yeah.
Okay.
Yeah.
Because one of the masked actually, Dr. Birch is her
Yeah.
name.
Yes, Dr. Deborah Burks. Deborah.
Right. And she had asked that he be removed from the task force, and she was ignored.
Yeah.
So if that's the direction, I mean, besides turning the CDC into a taco stand,
Yeah.
that's what the push is out of the Washington right now.
Yeah, this is extremely dangerous stuff. So what eventuates what Dr. Burks mentioned, according to the report, is that he's pushing junk science,
Yeah.
and we've been in a hurricane of junk science, and it is actually the reason we started this effort. It's the reason John and Terry and I and Karen got together and put together a weekly and now a monthly, is to fight disinformation, because disinformation is extremely dangerous. So let's tackle that right away. One of the things that keeps coming up at these rallies is that the accusation that Fauci said masks were not necessary early in the pandemic. And that's actually absolute falsehood. What Dr. Fauci was trying to impress on people is that, and we saw it with toilet paper, not to make light of it, but the hoarding of masks, especially the N95 respirators, which are available, or they were available in bulk for a number of industries, not just healthcare, commercially. So those would fast become scarce if indeed it was immediately recommended to the public that everybody wear masks, and that the safest mask to wear is an N95 respirator versus any other form of protection for your respiratory system. So just imagine if that was the message that was sent out to Americans in the first week of February. N95s would have been impossible to source for healthcare workers. If 160 million Americans in the workforce all went out and tried to buy N95 masks, the country would have faced a shortage that would have lasted months. So in order to not have that happen, Dr. Fauci made it clear that if you're not in healthcare, there was no need to run out and buy masks. That's all he said. So to twist that into saying that Fauci was against masks initially and then came around to it is bullshit. So that's one falsehood that we need to make clear right now. Number two is that there was somehow an effort to close our borders via, especially to travel from China and Asian locations. That travel restriction was not useful, especially at the time it was made, because we had nearly 3.5 million travelers in and out of New York City by then. So and there was already evidence in Europe, not just evidence, but there was a beginning of the strain on healthcare in all across Europe, especially in Italy and Spain, and then the UK, and then France, and then Germany. So within weeks of that already happening, and millions of people transiting back and forth between the United States during that time period via our eastern airports, JFK, Atlanta, our massive eastern airports, Newark, you name it, Miami. We already had COVID in this country, so banning travel from China when we already had 3 million odd visitors from Europe during that same time period, it was useless and pointless. And that's one of the reasons that targeting China and saying, this is a Chinese virus, etc., was described as xenophobic, because he wasn't doing the same for European nations. He was not wrong to identify the source as Wuhan district, China, et cetera, et cetera. And but that same virus went to Europe first, likely create the creation of a new strain. That strain being very different and already having been genomically identified as different in its infection on the East Coast versus its infection trend and a genomic signature on the West Coast. Anyway, this is all way too technical to describe to your average American. The point is this: no one has lied to you about the virus from the scientific community. No one has lied about masks. No one has flipped on anything that that we haven't been 100% clear on. We've discovered a lot of things about this virus. We've discovered that it's R naught in China it's different than it was in Europe. It's different than it was here in the United States. In fact, the R naught was likely much higher during the summer surge in the South, and that R naught was likely different because of a molecular mutation, D614G. We have on a weekly basis discovered new things about this virus, and the biomedical community has faithfully passed that information on. And if there has been failings, there have been failings in the detail of the science reporting and the what the American people are able to absorb. But they have the biomedical community has been fought every step of the way by a deliberate disinformation campaign from government institutions. And
Sanjay,
yeah,
they have weaponized every change of information,
yeah,
no matter how small. And to me, it was, I know we always tried to keep this non-political
yeah,
to
not
get
tonight.
information. They attacked Fauci, so that's pretty much gloves off now.
Yeah, yeah,
So
yeah. They went after our Godfather. So
That's
sorry.
right.
It's totally absurd and obscene to go after a guy who's been fighting on the front lines of infectious disease on behalf of this country and keeping it safe. going all the way back to the AIDS epidemic, where for those who don't know or don't remember 1984 and what it was like in this country between 1984 and 1989 with the AIDS epidemic, and how hard Fauci and his team had to fight to educate people about how this was not just a gay disease. This was going to affect the general population. This was going to become, a killer, and there's no way to contain it within the gay population. The reason he has a Medal of Freedom, a Presidential Medal of Freedom, around his neck is because of this work, and it was placed there by George W. Bush. So let's get very, very real. If you come after leaders like that, Ashish Jha, Dr. Patel at Brookings Institute, Dr. Osterholm at Minnesota, all of these brilliant workers that are the shoulders on which I stand as a young physician and as a young biomedical scientist. Those wars that they have fought on behalf of the American people's health, you go after those people, that's when my signs and my flags come out. I will go to war for
That's
them.
right.
And so, I've tried to stay apolitical, but they obviously haven't. They have tried made every attempt to obfuscate. They've made every attempt to undermine public health recommendations, data, information, the quality of how we address this, the infrastructure by which we can actually take care of patients and anticipate the needs on a region-to-region basis. For the next 2 weeks, and we've got 2 weeks to the election, I'm at war. I'm at war as a citizen. I'm at war as a physician. I'm at war to save the country from continued mismanagement, continued death, destruction, and incompetence. The reason we are seeing, and this was bringing me to my last point, which was what we're hearing most recently in these rallies as of the last couple of days, is that people are tired of COVID. No one is as tired of COVID as physicians and nurses. No one is as tired and sick of COVID as frontline ER doctors, ICU doctors, nurses, all of their ancillary staff, the people who clean those hospitals, the people who have had to live in a separate part of their home because they work in healthcare, the 220,000 families who have lost someone, the 8 million infected on the record, and probably 60 million Americans who actually have contracted the virus to date. And now over 800, maybe almost 900,000 of them are long COVID sufferers. No one is more sick and tired of this than them. So I'm speaking for them right now. No one is more sick and tired of COVID. And you will not get your economy back. You will not get your country back. You will not get your gatherings and your concerts and your Thanksgivings and your holidays and your schools and your whatever. You're not getting it back until we do this.
Sanjay, real quick. Sandra, could you mute yourself? You're talking over him as he's speaking.
Oh, I'm sorry.
That's okay. No, a lot of times we'll unmute ourselves and we don't realize we're broadcasting out, but I figured I'd say something.
Yeah, thank you. Sometimes it reverbs too. So this is the fight of our careers. As I've tried, we have that time difference, but we on our page we have Dr. Daniela Marasco, who is now facing the second wave in Italy, who joined our team, on our page and has been sharing information. She's like almost our crystal ball. I mean, she told us what was happening in Europe back in March when we just started this, they had already been through about 6 weeks of this shit, and she was telling us what it was like. And we have Dr. Natasha Zarich, who's a PhD in immunology. We have Dr. Sunil Nuthi in India. We have Dr. Halapnar, who's a naval medical officer in Pune, India. We have Dr. Sharad Haridas in the UK. We've got all of our friends and colleagues who are nurse practitioners, RNs, respiratory therapists, all across the country here in the United States and Canada that have been reporting in on our page. So they're all telling us the same thing. Unless and until we address this, and nothing goes back to normal. There is no back to normal. And just because you're tired of it doesn't mean you get to put it down and go play something else. Because that's what juveniles do. That's what little toddlers do. When they get tired of a toy, they go play with something else. Or they couldn't figure out a puzzle, they throw a little tantrum and they go try and do something else. All right. So that's what we're seeing out of Trump and the leadership. And Scott Atlas,
douchebag.
I'm not a good plastic surgeon. Do you know why I'm not a good plastic surgeon? Because I've never fucking done it. I'm a great physician. I'm a really good molecular biologist because I went to an Ivy League school. I was highly trained by highly skilled physicians, and my dad was a master cardiologist. I'm steeped in this, but I would never take on a plastic surgery. I could do an appendectomy or deliver a baby, or do all those things that a physician should be able to do in a pinch. Okay. But there are certain specialized areas of medicine that even us who are great at what we do in medicine, okay, we defer to our colleagues who have studied it for decades, who are trained in it, who do it every day. Dr. Shola Fasusi, my buddy down in Miami, Florida, if you want plastic surgery, I'll give him a call, fly down there. He's a genius and a god with his hands. Okay. Don't come to Sanjay. If you want a massive population health database and evidence-based medicine program and a physician assessment, for positive deviance at a massive healthcare system or even a country, you can call Sanjay and I'll get it done. To call Scott Atlas into a coronavirus task force just because politically he leans and agrees is the kind of sycophancy and the kind of it is. I grasp for words at that man's conscience. I grasp for words to describe that man's conscience, other than he probably doesn't have one. I think I joked on Terry's page the other day. This guy shows up on the coronavirus task force, and within weeks, the entire White House is infected with COVID. What does that say about him?
Well, his claim to fame on Fox News was pushing herd immunity long before he ever ended up on the task force.
Yeah,
he denied it. He denied it at first, but if you had watched any of it, and I saw some of the video, that's the road he was going down to months and months ago.
So maybe we should have David chime in here before I get to the other topics. David, do you have any thoughts on this, this level of disinformation, how, it's getting so difficult to, it's never been clearer that it's false, and yet it's never been harder to fight it. And then you have people with qualifications, not the right ones, like Scott Atlas. It was a farce when the Nigerian doctor and her group came around and talked about hydroxychloroquine. It was absurd, asinine. But now we have him in the ear of the president Dr. Birx has been sidelined. Fauci hasn't been to the White House since August. No one that makes, has any credibility could make any, recommendations for where we are now, and which is really on the edge of a massive outbreak that Dr. Osterholm and others have described as we're now facing the darkest 8 to 12 weeks of the pandemic that we've ever seen. Take it away. Tell me what you think.
So I'm just jotting down some notes here. So in terms of disinformation, there's a Nature article that I can share in the chat after I'm done talking that talks about the roots of disinformation and how it spreads. And it's easy to think that there's some single or small number of entities or people that spread this, but quite often it's people who are just participating it, spreading it, and it generates its own carrier wave. It just moves well beyond it. And there's always like a corn kernel of truth, which is the worst. And sometimes it's spread unwittingly. You tell your friend some advice, and like the game of telephone, it gets turned on its side. But disinformation oftentimes is just like memes. They're things that we even otherwise smart people share, or hold beliefs, or even just misheard things. So that leads you into how do you fight that? And there was some interesting research that a thorough debunking works okay, but the more you talk about it can also lead to myth persistence. And so sometimes like you have to have contestation. So we need to speak out. We need to be doing this. We need to be saying something when we see something, but there's also the way you go about it matters. And so debunking it is one thing, but also pointing out the logical inconsistencies. And sometimes that does involve pointing out why a source doesn't have the correct authority. So just to go back over that, pointing out logical fallacies works as well as debunking alone. And also that disinformation isn't always what we think, and sometimes it's spread even by well-meaning people. So I don't know if that really specifically answered, but in terms of something, okay, I'll give you a perfect example. Like what do I mean that you can recognize? Even people who are pro-vaccine will say, I went and got my flu shot. How long before I get autism? And that myth then persists in conversation, even though we know it's been debunked. We know the Institute of Medicine resolved this in 2010. And I mean, it's been done over and over and over again. We know the doctor that suggested it was thimerosal, which wasn't even in MMR because as a preservative, it would have inactivated a live attenuated vaccine. So the ingredient wasn't there in a vaccine he never studied, which conveniently had single vaccines to sell you. That's a fun story. But the myth persists even within a community of people who actively fight to support it. And so those types of things can persist long after they've been debunked in ways that are so much more pernicious, which is so much fun.
And it goes back to that. I don't recall who said it, but there's even a beautiful Renaissance painting about it. I think that the lies are often running before the truth has a chance to get its shoelaces tied or something like that. And just think about how much has happened between the last time all of us met. At the last update, we had Mike Kidd take us through all of the data, right? And he talked about what would happen if we tried a mitigation strategy again, or I should say get serious about a mitigation strategy, or what would happen with a lockdown / suppression strategy like was achieved in New Zealand, or what happens if we just let it rip. That's where we were a month ago. Since then, the president, his wife, his son, his press secretary, his former campaign manager, this list of like 26 people in the White House got COVID. The man was in hospital for 3 days. His debate prep buddy, Chris Christie, was in the ICU for 7 days. And yet they emerge from this, and Chris Christie has the humility to say, yeah, I should have worn a mask. That kind of sucked. Good. Thanks, Chris. But this idiot has the audacity to go out and say, I'm immune. Like, he says things that are absolutely false or unverifiable. He could have still been contagious or infectious to others in the days after he left the hospital. And he was at a rally, I think, only 4 days after he left the hospital. So, like, if you are under my care, or anyone who has any, any credibility or sense and background in infectious disease, he would be isolated for 14 days, even post-hospital. He wouldn't be allowed back in public until he had tested negative twice with at least two negatives, at least 24 hours apart. But now these are dropping like bombs on his followers. They are now doubling down on, this is not dangerous. The president got it. He was over it in 3 days. He's fine. And then they are talking to
The Chinese board, can we plan it?
Yeah, go ahead. And now this myth is going to circulate that it's not dangerous, and he was right. Okay, and that he's in his 70s, he's overweight, he got it, and he was fine. So all of these Faucis and Udoshis and all these guys with fancy letters after that, they don't know what the hell they're talking about. They're just making stuff up to scare us, to bring down the economy, and get him out of office. So it's so now entwined, the politics and the disinformation are now so entwined that just to pull them apart is the first step in combating the massive disinformation. Like, I don't even know what to say. Just want to finish up the thought of last time we met, that's where we were with data. Now we're facing a prediction that Mike and all of us made, Terry, Mike, and I, that this is inevitable. This cold weather snap, bringing people indoors in large groups. Now, a readily identified new way of creating transmission is small family gatherings of people, larger than 8 people in a room. That's all it takes. That's all it takes to send a couple people home as carriers. And even if one was asymptomatically carrying, just to put them in a room with 8 other people will then send it out back into the community in the nose, mouth, and lungs of 3 to 4 others. And that's a new route. And guess what's coming up? The holidays and traveling and Thanksgiving, all of it. Hanukkah, Thanksgiving, Diwali, Christmas, everybody's spending more time indoors and being with each other. We know this is going to happen. We know that Dr. Osterholm, from a scientific standpoint, Dr. Osterholm is absolutely 100% right. The next 8 to 12 weeks are going to be the darkest of this pandemic in the United States. But we've got 30%, 32%, even as high as 37% of people in this country believing now, as a result of the experience of Mr. Trump with COVID, that he was right and we are wrong.
He said in a rally 2 days ago that if the other guy wins, he will listen to the scientists.
Yeah.
I mean, how can you write your opponent's commercials for them like that? I mean, that plays with his group, I know, but shit.
Yeah, man. Yeah. well, I mean, and then there's good news. There's Jacinda Ardern wins a second term in New Zealand. Her party, which is the progressive side of New Zealand politics, wins a record number of seats, and she won on the merits of her response and the fact that thousands upon thousands of New Zealanders' lives have been saved because she responded in the way she did. And we talked last time about I don't know how to get breakthrough to people anymore. How has it become normal to lose 1,000 people a day to one disease in this country? If it was if it was a terror attack, or you know what I'm saying, like if it was anything other than being desensitized for months to death and destruction, and then just that having that be normal. Every day, 938 people died today of COVID. Next day, 1,128 people died today of COVID. Next day, 837 people died today of COVID. And it never goes, below 400. It never goes below, and the case rates are going up. I don't see a point in repeating the numbers anymore because no one seems to be listening. I mean, us, the sane majority seems to be listening, but the irrational minority are threatening us now. Their behavior is threatening the rest of us. So
I got a question on Facebook, which is going to be good because it's going to be coming up so quickly. Carrie Ramp asked, how will you be managing the holidays? Gathering with limited family, but with masks, no gatherings? She wants some advice.
This is a very good question. And in fact, I had to deal with a friend and a neighbor who has been very lucky, has children and family in the area, and they gather. They stopped during the height of it early on, and then the summer months they were able to just have a lot of outdoor activities with kids. But a lot of her family members are very high risk. Okay, and in this lull in Pennsylvania over the August-September time period, which was us having a percent positivity rate of 1 or less for weeks and weeks here in Luzerne County, family gatherings were somewhat normal for them, even with their high-risk family members. And we had a short conversation. I made it clear to her that I don't want to reason. I don't need to reason with you. You have the background intellectually and otherwise to understand that it's not a good idea. It's just not a good idea. Even at 1% positivity in our community, even at 1%, to put 4 people who are at high risk because of their age or because of their medical history in the same room together with children who go to school, it's not a good. And the excuses you're going to hear are, my family wears a mask every day. All of the people who are high risk in my family will be traveling with masks on, with goggles on, etc. There's, all of us are behaving responsibly. And then it takes like 2 or 3 or 4 hours without a mask together in the same room to make all of the sacrifice, all of that progress, all of that diligence be nothing. So if you are planning a Thanksgiving gathering or a Hanukkah gathering or a Diwali gathering or whatever, don't. That will be my advice to you. Let it go for 1 year. Let it go. Buy one month of Zoom Pro and get everybody together. I mean, I would be absolutely irresponsible to tell you that it's okay and everybody should just wear masks and everything will be all right, because one mistake for just a short period of time could result in disaster. So we won't be traveling for Thanksgiving. My family, Karen's has a large family in central Pennsylvania. They very much have a beautiful tradition of getting together on the holidays, and all of them realize that with the age of Mimi, the grandmother, matriarch of the family, with others, you know, um, no, it's not just not going to happen. It's not going to happen this year. And I would urge that you keep your bubble extremely small for the next couple of weeks to months. Extremely small. And I'm not trying to scare people. I'm not trying to damage the economy. I'm not trying to, kill our dear president's chances of reelection. I am. I'm telling you this because we know that you. I mean, I hope this makes sense. You can spend 4 months being diligent, and it can take 4 hours of not being diligent to destroy that. Okay, so that's my answer. Terry, are we okay on questions?
Well, Amy Lansing on Facebook, this is going to be detailed.
Okay.
And it goes back to what you were talking about in the beginning about women in antibodies. Do we know at what point COVID-19 antibodies may no longer be present? If so, COVID can't be determined as a source of autoimmune response. And she also more details about that, and blood values would you expect from someone who already has SLE? Finally, is the COVID-driven autoimmune response similar to what's observed in youth, either multi-system inflammatory syndrome or Kawasaki disease?
Absolutely. So let's answer that back in series backwards. So
Okay.
Absolutely, the autoimmune response is parallel in functionally parallel to what we see in the Kawasaki's and multisystemic inflammatory in children post-COVID. So we don't know exactly why it affects women more than men, so significantly more, but let's take this in parts. One, women are more affected. We don't know why. In women, the autoimmune response is parallel to Kawasaki's. It is driven by a molecular mimicry. Okay, so this is a little bit different than SLE, even though the biomarkers are similar. Okay, so with SLE, there is both an epigenetic and genomic cause to lupus. In this circumstance, the immune response is a maladaptive immune response in the sense that the antibodies being produced have been triggered by the COVID infection, but what they are attacking, or what the antibodies are most tuned to attach to, are self tissue. Okay, so what does that mean? Some part of the virus is molecularly similar to some proteins in the human body. This is hard to describe. It's even, this example might actually confuse you, but I'll give it to you anyway. So if you were to rake out a patch of dirt, and then you were to dump out a small 1x1 plaster mold on top of that, okay? When you pick it up and it's hardened, you'll see ridges and little, divots, and it will be very specific to that patch of land. All right. If you move that to some other part of the yard, guys, some other part of the yard, it's not going to fit perfectly. Okay. The where the rocks are and where the divots are in the dirt, they don't match to that area where the mold was taken. All right. So that's very similar to the binding regions of a antibody. The two binding regions of the antibody are tuned to a very specific landscape or shape what we call the morphology of viral protein or whatever it's meant to bind as a result of its the production of the antibodies. It's partially highly random that the recombination of the genes that specify antibodies will be specific enough to bind a viral particle like a spike protein or an envelope protein. But it's also what we call a library. So there's a monoclonal library of things that the human species has come across in its evolution. So evolutionarily, we have a library of antibodies that our predecessors, all the way down to very, very simple primates, millions of years ago, that were beneficial for their survival. We brought those forward with us into this state, Homo sapiens. That library contains so much diversity that at times when an antibody is triggered, it actually is responding not only to that viral stimulus, right? It's not only specific to that viral stimulus, it actually also might be specific to other proteins that exist normally within our body, okay? Those proteins could be part of our tendons and joints. Those proteins could be part of our nerve cells. They could be part of our cardiac cells, the lining of our arteries. So they are a vast category of types of proteins. Proteins that hold our cells together, called integrins, pathway proteins and receptors that are responsible for a hormone response, like insulin, glut receptors and things like that. Anyway, it's very technical, but the point is this. Something in COVID is very similar in shape and size and appearance to a group of unidentified proteins in the human body. And that that protein expression might actually be more common in women than it is in men. This much we can ascertain from this observation that women are more likely to suffer long COVID and are more likely to develop antibodies long after the virus has caused fever and gone away and caused whatever damage that the virus does inherently with its infection, to the extent that the body still thinks that the virus is a threat and continues to form antibodies after the virus is no longer detectable. Those antibodies go on to stimulate damage or a immune response to your nerves, cardiac tissue, kidney tissue, joints, tendons, the entire integumentary system. And so the constellation of symptoms are persistent long body ache, insomnia due to pain, fog, the kind of COVID fog, as a result of reduced or diminished blood supply to parts of the brain that are responsible for consciousness and awareness and wakefulness, myocardial damage, all of these things that you would see in a lupus patient are similar symptomatology that you would see in a long COVID patient. And it's a similar etiology of the fundamental molecular biology that's causing it, but highly divergent in the reasons why it was stimulated. So like I said, lupus being epigenetically and genomically having some sort of explanation, long COVID in women as an autoimmune response, not yet elucidated as to the reasons why. But in the last few weeks, those titers, which you asked about, which are often looked for in anti-double-stranded DNA, anti-nuclear antibody, and I think there's 3 or 4 others, anti-Smith and things like that. that are very indicative of a specific autoimmune response, those titers have not been done enough in these patients for us to know what level, how does that compare to a SLE or autoimmune patient, those levels that we see in those patients versus what do we and what do we see or what should we anticipate in long COVID patients with similar antibody titers.
Okay, that I knew that was going to be a long answer. We did have one more question, and it was from David. So,
Okay.
David, do you want to hop on and ask that question? I don't want to misread it here. There you go.
Sure. It's actually something I understand very little about. So I've been trying to read. Obviously, we all know about R naught. We've heard about it by now. It's on every single news network has talked about it. But I'm reading a little bit about dispersion parameter K.
Yeah.
And I didn't know if that was something that you were familiar with and something that you could maybe give a rough overview of.
Yeah, I mean, it's a highly technical question. I wish I had Mike with us to talk about the biostatistics that are associated. Is he on with us? But the biostatistics associated with it are a little bit beyond my ability to explain, to be honest with you. Can you give me just the background definition of dispersion again, so that I can probably tie that to R effective versus R naught, and why R naught and R effective aren't as useful. Although I mean, I recall reading this a while back when Mike published it, and I posted it on our page, but the actual details elude me. So tell me what you know, and I'll try to kind of join in from a clinical perspective.
Sure. So it pertains to sort of like the clustering effect, you know, R naught being the average number of infections, but that doesn't necessarily help us identify outbreaks, where they're coming from, where they'll happen next. And so this has to do more with how easily something spreads within certain environments. So essentially, you know, why do you have, say, for example, I know out of China, there was something that showed that I think like 80% of cases came from like 19% of like how many people could have entire households who either there's not many cases or no one else gets it because they isolated in time. And so how does something still spread so rapidly, even, you know, from, you know, who are the super spreaders or what are super spreading events? And so that was kind of a little bit about it. But again, I'm just kind of dipping my toes in it. So it has to do with kind of negative binomial regression modeling, which is
right,
also
which is
well
why we
beyond
need Mike and not me.
I didn't know if there was a layman's way of explaining it.
You know what? I will read up on it, and I will report on it next time, because I think
Nice.
by next time it will be very relevant and also evident that you know, we will in 4 weeks' time. We're probably going to be right neck deep in this wave, and I will read up on that so we can have an educated discussion on it. But
I'm hearing from some nursing friends here in Boston that some of the places they're not opening their command centers, but they are preparing to open them. If they haven't, they're prepping for that.
Absolutely. I heard the same thing. My daughter's a BU student, and we're seeing, like, you know, we heard from University of Michigan that their students were told to lock down. I think it's Ann Arbor campus. That means for the next 2 weeks, no classes, no movement, nothing. And you know, that's our greatest fear, right? As dad of a college student, that you hear first your freshman, you know, is in college, first semester, and this hell is, you know, spiraling around their campus. They've been extremely diligent about testing, about you know, the safety of the students and the campus. And I'm really happy with Boston University. Others have done horribly and continue to do horribly, which we saw, you know, last 1 month when I put up that comparison of all the campuses across the country being new niduses of infection. Anyway, so it is highly curious, right, to have seen high transmission rates in the South, and we've had declining hospitalization rates. So let's cover these numbers quick. In the beginning, John, Terry, Karen reported that 80% of those who contracted COVID, we're talking about the first 3 months, got through it with a mild to moderate flu-like symptoms. 10 to 12% had moderate to severe. About 8% ended up hospitalized. About 2% ended up dead. So that was in the very beginning, the 3 months, right? Recently, we have seen that about 80% get through it, mild to moderate symptoms. About 10% have the worst flu of their life. About 6.5% require hospitalization, down from 8. And about 0.5 is now the hospital mortality, down from 2 or 2.5. Okay, these are estimates, but initially mortality was 2.5%. Now it's down to 0.5. That's a very, very significant reduction in mortality. Hospitalization has gone down significantly as well by about across the population, 1.5%, which is very significant numbers. So, and then there's a delay in hospitalization as well. So the severity of the initial infection is not seen or is more tolerable than it was in the initial part of the infection. So what does that say? That, people kept saying, oh, the virus is weakening. We fought that myth. Virus is not weakening. We still have the opportunity for mutagenesis and for new strains to emerge that either are less transmissible or more transmissible. In the case of the southern strain that caused the outbreak in the South this summer, it was more transmissible, but it ended up being less devastating in terms of the course of disease. So is that now the prevalent infectious strain in the United States? Hopefully. Let's all keep our fingers crossed that it is. But we're seeing less hospitalization and less death from this. We still don't know what constitutes a true super spreader event. We know that it's facilitated by proximity to each other, the duration at which you are in proximity to people, and the amount of inoculum.
And Trump rallies.
Yeah, well, it is. Yeah, that's the definition of a super spreader. So, but if you look, the curious thing in the days following the COVID infection announcement of the president was all of that Amy Coney Barrett's celebration of nomination in the South Lawn, or whatever it's called, the Rose Garden. It doesn't have roses anymore. There was a pictures and video of all of these people talking to each other within a foot of each other, within 2 feet of each other, and doing that indoors and outdoors, and spending all this time together. That to me, I'm just trying to draw a parallel back to the question earlier from Carrie, which is that's what a family gathering looks like. At least in my family. I'm guessing in a lot of families, just a lot of people of, being gregarious and affectionate with each other, talking face to face, and all maskless, and doing that for hours. That's, and I loved the defense of these rallies being, we give everybody access to hand sanitizer, we hand out masks, and what they do with their freedom is up to them. Hand sanitizers, for God's sake, great, use them, especially if you're coming back from a public place, definitely. But as a primary prevention method for an aerosolized virus, to keep pushing something that just is not you know, it's such an obvious waste of time to have in that kind of a gathering, everybody hand sanitizing when they're talking to each other like this for hours. You know, the um, we know what spreads this virus. You know, practically we know it's duration, distance, and the size. You know, the amount of the inoculum. So that is that that is to be avoided, intensely avoided. Remember March, April when we said when the country was advised to be in lockdown, please don't leave your house unless it's absolutely critical, blah 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 blah. Well, I'm reinstituting those guidelines for you right now. Okay, between the middle of November and the end of the year, even like, you know, first week of January, be in lockdown. Be in lockdown. Avoid all, you know, all of that. Do all your shopping online. Don't be around people you don't know, even if it's masked. Okay, make that an absolute minimum. And I feel bad. I'm looking at my friend Don's face here on the screen. And last time we talked, I said, Don, don't be so obsessive. Relax. You can, you can do your Vermont thing and not be so scared. And now I'm giving him the exact opposite advice because other people are putting him at risk, not his behavior. It's other people who will not listen to what we have been saying for the last 6 to 8 months. Some of them, or most of them, have gotten very lucky. And if you get it, the majority of you will get through it without much issue. Just stating facts. This is pure statistical fact, right? It's just going to be a lousy time for a couple of days for the majority of you. But for those who aren't lucky, or for whatever reason down at the molecular level, you are susceptible, just like a 34-year-old marathon runner that died 4 days after contracting it. You know, if we could do a molecular pathology and find out what the hell happened, that this virus was able to kill this extremely healthy young person, that's the task of biomedical science for the next 10 months. And until then, we only have this. We only have avoidance, masking, diligence. That's all we've got. Rounding a corner is bullshit. These are not embers to have 70,000 new cases a day. Dr. Fauci is right. He has been right. Dr. Ashish Jha he was at Harvard. Now he's dean of Brown's School of Public Health. They're out there every day. Dr. Hotez down in Texas. These are people you can listen to and trust. And it just makes sense. We're going to have to sacrifice a little bit more because a few people haven't sacrificed enough at all.
Hotez is awesome, by the way.
He is awesome.
I recommend him highly to anybody.
Yeah. You know, he did develop the first SARS vaccine. He just couldn't find someone to commercialize it. You know that, right? He has.
I actually didn't know that offhand, but just he's involved with some of our efforts to push back against the anti-vaccine advocacy we see online, and so he's been very willing to engage and be responsive, even to lay people like myself. So he's been very helpful finding information and talking honestly about things. So I really appreciate his candor and his energy.
He's outstanding.
Yeah.
He's brilliant. He's outstanding. He's like a first line basic science research guru. You know, like he has in his lab right now down in Texas the vaccine for SARS-CoV-1. No one was willing to commercialize it because NPIs alone burnt it out. So, and he's from 2009 all the way through 2012. He has all of these papers and publications on his vaccine, and he sought a commercial partner, and no one wanted to do it. But anyway, so let me go back to our. So, am I sharing? Yeah. Okay. So this is the mess that we're facing right now. Europe is on a trajectory for somewhere in between Saturn and Jupiter right now. It's on a launch trajectory. So India, oddly enough, has had now its first wave. In a nation of 1.3 billion people, that's what a first wave looks like. Okay. And so it can't, you can, and additionally, their seasons are very different. So you can expect that to be the second wave to rejoin if they don't bring that under control. At least in the north, the weather will change shortly here, and people will be brought indoors, similar to what we have across most of the United States in the winter, and that line may change drastically again. The United States will follow Europe, probably in a similar fashion, about 1 to 2 weeks behind the European trajectory. So that's
Hey, Sanjay,
yeah.
I think you can draw a line across the United States about a third of the way down, and they're hot into it right now. You know, if you win everything above South Dakota,
Yes.
It's hot red.
Yeah.
And in a month from now, that line is going to be down to Arkansas.
Yes, it is. That's right. That's exactly how it's going to work out. As those temperatures drop, and that latitude is going to drop all the way down on the map. More and more stuff happening indoors. There's been big. So because we don't have true data gathering, we are left with anecdotes. And one of these anecdotes is that the church gatherings are big spreader events. Family events like weddings are big big events. Anything that looks like that Amy Coney Barrett gathering, anything that looks like that, okay? Whether indoor or outdoors for the next couple of weeks, if it looks like that, it's a guaranteed super spreader event. If it's a family gathering, it's a church gathering, if it's a festival, or, if it's 10, 20, 30 people, anything over 10 people gathered together where they're all there together for a couple hours, that's a spreader event. Because we know that, at least 40% of those who test positive will continue on being asymptomatic until they no longer test positive. I hope you all understand what I just said. 40% of people, if you take 100 people and they all test positive, 40 of them will march through the next 2 weeks without being symptomatic, and then they will eventually test negative in the period after that. But during those 2 weeks, they are as infectious as anyone who's coughing and feverish and sick. Does that make sense? Do you have any questions there? Because those are the people that are, unaware, unwittingly spreading this to others. There were plenty of people in that Amy Coney Barrett event that were carrying the virus. It wasn't 1 or 2 people. There were likely quite a few people there carrying the virus. And that's how that was so easily spread among until 26. I think 34 was the final tally, because there were White House staff that eventually tested positive too. We never heard their names or who they are. Who's putting hearts on my screen? Yes. So yeah, that's exactly what happened. So just imagine, you've got young, healthy family members coming in from a hotspot to a Thanksgiving event. They don't know they're positive. They feel fine. They will never feel sick, but they will have spread it to 3 or 4 others, um, or at least 2, because the R naught is 2, at least 2 um, other family members at that event, at least 2. Okay, so this is, we don't, I mean, I just look at, guys, this is when Italy was running out of beds back here. This is when trucks were pulling into towns in Foggia and Lombardy to pull people out of morgues, military trucks. This is when New York had to set up a field hospital back here. And a ship was sent to New York City. Look at where we are now. And that's an alarm bell. Okay. So yeah, so we talked about this. People are tired of hearing about COVID. They're sick of all of the death and news and depression, and I'm sick of it too. I don't know anyone who's enjoying this. Okay, there are no Democrats that are cheering for COVID right now or ever. There's no one that wants to prolong this. I wanted this. I can't. I'm looking back and looking at some of the stuff that Terry and I talked about and put together for the town halls in June and July, and I'm like, well, I hope we're over this. I hope things move on. Life gets back to normal. I was predicting May 15th, Pennsylvania would open back up. May 15th, I was predicting, if everything works out, Pennsylvania will open back up. It's October effing 20th. And this is what the country looks like. And we've got 220,000 people dead. And we've got over 8 million infected in this period of time. And dear leader is saying that people are tired of hearing from idiots like me and Fauci, and we've gotten it all wrong. And okay, the numbers say otherwise. The map says otherwise. People's misery says otherwise. I remember Dr. Fauci a couple of weeks saying, you may not like me. 50% of the country may think that, I'm a bad guy. These are his exact words. Okay. You may not like me. 50% of the country may think I'm a bad guy. But if you were to listen to me for 6 weeks, we could bring this, in for a landing. Nobody's willing to listen to for 6 days. And this is why we have the highest number of cases, the highest number of deaths, the worst effect to our economy, the most prolonged time period of devastation of any industrialized advanced nation. So, all right. So I think that my topics are, what can I say? So Mike and I were talking about remdesivir and a WHO paper that indicated across a broad swath of demographics that remdesivir in hospitalized patients has little or no effect on mortality. That's not a bad finding. It's just a finding. So it's not like, the remdesivir is therefore useless. But one of the things I haven't gotten an opportunity to reply to him on our resource page, on our page is, I don't just look at the numbers. David talked to me about or asked a question about the K coefficient and just dispersion. I don't know enough about it to give you an educated answer. Maybe we'll get Mike to talk about it because he's the one who introduced me to that. But I will try to introduce to you now a response to some of these papers' findings, which is clinically, it's much, the numbers aren't telling the whole story. So it is very possible for two clinicians and two biomedical scientists to look at the exact same paper and the exact same data and the exact same confidence intervals and p-values and say two different things about the utility of a therapeutic. Okay, so is remdesivir useful? The answer is maybe. What people would prefer to hear, patients especially, or people, you know, who are under risk of falling ill and may have to, you know, rely on one of these things if they have to go into a hospital setting, what they want to hear is, yes, one of these things out there has proven useful in A, reducing mortality, B, reducing length of stay, C, reducing symptoms, or all of the above. And so far, the evidence suggests what it suggested 6 months ago, which is trimodal therapy is the answer to the treatment of patients. Which of the individual elements in that therapy is more effective is an area or arena for study for the next 10 months. What does that mean? So trimodal therapy is immunomodulators, anticoagulants, and antivirals, okay? So remdesivir is an antiviral. It's supposed to mess up the replication of the virus by introducing an analog of one of the nucleic acids that messes up its ability to create more copies of itself. Do we have the dosage right? Are we giving it at the right period of time in the viral life cycle? All of those questions are still up in the air, okay? And we have to look beyond the numbers that say yes or no. Groot, I'm on a COVID town hall. Excuse me. What? What do you want? What do you want? What? Oh my gosh. All right. So the answer is we don't know. So comparative effectiveness studies need to be done. If it's an antiviral, then it should work as an antiviral with other viral syndromes. Have we given it to flu patients? Is it as effective as Tamiflu? More effective than Tamiflu? Less effective than Tamiflu? Will it work with other viral syndromes that cause fever? Nobody knows because nobody's done any tests yet, which is why you don't give it, you know, to you don't just report on the results of one. You don't act on the results of one paper. Okay, you never do that. You end up putting this in the bin with good news but not great news. Okay, and you wait for more evidence to accrue. But dexamethasone and our tried and true anticoagulants are saving lives. So we'll continue to make sure that patients avail of that. As far as the new esoterica like Regeneron and poly or monoclonal antibody therapies, not enough studies have been done to say one way or the other. I will say that even with mild symptomatology, at that age and at that weight, his recovery, the president's recovery, was remarkable. Okay, so you don't. This will start the whole hydroxychloroquine noise machine up again, except we'll replace HCQ with Regeneron, and it's all the same mythology. So we don't know whether Regeneron was the reason. Chris Christie made it out of the ICU in 7 days, and this idiot was able to return to the White House in 4 days. We don't know. And even the CEO of Regeneron said this is the worst form of evidence that we could possibly use for advocating for Regeneron. So anecdotal evidence, fascinating, but it means nothing in clinical science. Okay, so that's on therapeutics. Vaccines, we're exactly where we were a month ago at the September update. We are in phase 3 clinical trials. A number of them have been paused because of adverse events. These adverse events happen all the time. People are saying that, oh, the FDA should be telling us about what adverse events. These companies should be making these public. No, they shouldn't. I can't stress enough why they shouldn't. This is a process. Leave them to their process. Okay. There is such a thing as necessary transparency. There's also such a thing as not interfering with public, not creating undue concern among the public or making a mess of public opinion before true, valuable, consistent results have been achieved. That then then when we do get this out there, we're not undermining public confidence from day one. Dave, do you have anything to say about that?
I'm sorry, specific to what part?
So, we've heard that a lot of these vaccine trials have been paused because of adverse events. I was mentioning that as a clinician, this happens all the time.
Yeah.
And a lot of people are complaining, even from, it doesn't matter, left or right, they're complaining that the FDA is not being transparent enough, or these companies aren't telling us enough. And I'm saying that they shouldn't. I agree with their lack of transparency at this stage, because I don't want to know. I don't want the public to know. I want the public to know when, that white sheet comes out with it, that details all of the adverse events and all of the complications and possibilities. But to undermine public confidence in a vaccine, A, B, C, D, or E right now, when we already have massive public disquietude and lack of confidence in science and vaccines and medicine, I just don't think it's appropriate for them to be saying, every adverse event at every moment. But what do you think?
Sure. So I think a couple of things. One, with 10 to 19 million people in clinical trials every year, I'd be surprised if trials weren't stopped.
Yeah.
If you didn't see trials being stopped, it means things aren't being disclosed. So seeing them stop, maybe we wish it didn't, but it's a normal part of it, and it's the ethical thing to do. In terms of sharing those things, you don't necessarily, well, one, there's patient privacy issues, but also, really more importantly, you don't know if it's related to the vaccine or not. You don't know if it's related to the treatment at all. The vaccine adverse event reporting system has some really, really weird ones in there, like gunshot wounds and drownings and car accidents. Now, I'm not saying that these are as less likely, but that also, this goes back to how do we report things. So, for example, the vaccine insert for the chickenpox vaccine has teething listed as an adverse event. But then the difference between what's an adverse event and what is an adverse effect that's medically verified is definitely an important point we highlight a lot between, well, why does it say that on the package insert? And why was it reported? And is it, if it says it could do this, well, it didn't, and here's what it's actually saying. So highlighting adverse events, what they mean versus adverse effects is important. And I think it would, to your point, could really disinform a lot of people unnecessarily for both positive and negative reasons.
Agreed. So that was my list of topics. We aren't very far along here in terms of vaccine development, much more than we were a month ago. We aren't in possession of a lot more evidence on therapeutics. than we were 3 months ago. We do know, as we knew 6 months ago, that distance, duration, and amount of exposure are the primary reasons for transmission of COVID. So avoidance of those results in higher safety and protection of you and your family. And that's all I can stress for you until we come back a month from now after the election. And, you know, I always say, hopefully we're not where the models and predictions indicate, but I'm not hopeful anymore. I get my healthy dose of cynicism from Terry every week, but now it's finally sunk in. The poor guy's been struggling with me for over a decade, but it has really sunk in. We're facing the next 8 to 12 weeks of real darkness when it comes to this pandemic. So the last topic we have is an open floor to talk about the election and the post-election and what it means for the pandemic response, COVID in general, living with it, and basically everybody can unmute or as they wish to express their opinions.
Sanjay, I do think about 4 months ago, I called the complete nightmare of a winter for us.
Yes.
And it's happening.
Yeah. Yeah.
I think it's going to be worse than what they initially predicted.
Yeah. And so what did Fauci and even you said, we could see 60, 80,000 cases a day. And we did during the summer with that post Memorial Day prediction. So, and then Fauci said 80 to 100,000 in this second wave is possible a day.
Yeah.
And we have stressed this over and over and over and over again. Our issue is not with, our issue is not with the 80% of people who will get through this. And it's that, you have certain 68-year-olds who will get through it in 4 days. You'll have 32-year-olds that are killed by it. You'll have 12-year-olds that will come down with this this multisystemic inflammatory syndrome. You'll have all kinds of cases. There's now an outbreak in Maine, a very small one that's being handled. And this is what we're facing. So it's not that, the greater the volume of cases, the greater the volume of long COVID, of stretching our healthcare system to its brink in various regions. And then the higher the eventual long-term cost of this. We've come at this from every angle. We've come at it from the epidemiology, from virology, from the immunology, molecular. We've come at it from the financial. We've come at it from the mental health, and talking about how, the general mental health or collective mental health of the society is of concern now to me, because I think that a lot of people, including myself, have gone through waves of despair through this. So it's not frank clinical depression, followed by suicidal ideation, followed by, recovery or whatever. It's just this cyclical, have a week of feeling okay, surviving, okay, things are okay, kids are back in school, kids are healthy, kids are happy, and then being forced down into the sense of impending doom that, okay, well, Thanksgiving's canceled. Okay, that trip's canceled. Okay, kids' school could be go online by the end of, by mid-November if things keep going like this. it's just awful. It's awful.
Gary Rant asked on Facebook, crazy question, but it really isn't. If Biden is elected and calls you, what would you say we should do? And I'm like, he's got Fauci. Why, you know?
Thanks, Terry.
No, I love you. I love you, brother. But, you know, Anthony's got it going on. I'm just saying.
Absolutely. That's a great question, you know, and it's first thing I would do is a governor's conference. It doesn't have to be in person. It would probably be over a weekend, and it would be a very detailed national plan laid out and get all of their consensus on whether they want to do it or not. And if they don't want to do it, then they would be publicly humiliated and embarrassed by the White House.
Cut federal funds, they'll do it.
Well, I don't want to hurt the people of their states, but if they're going to be dickheads, then the power of the bully pulpit needs to be brought into play. So, I mean, I think, you know, we have our differences, Terry and I, on our opinion of Obama, but I think that in the first 2 years when he was pushing for healthcare, he used the bully pulpit pretty effectively. And I think that this would have to be done here too. So what I'm saying is a governor's conference to get everybody in line as to, you know, what are the targets and what are the strategies that they all have to be using, and that you know, percent positivity, cases per every 100,000, weekly targets for you know, for the way that they access, or sorry, weekly targets for the way they gather and submit data. It all has to be homogenized, and then it has to be down to zip codes on targeting. So if you have an outbreak, you can target a zip code for shutdown. Okay, not even a telephone area code. I'm talking about a zip code, like they've started to do in New York City. Okay, so if you see 12 cases emerge in a zip code, every business in that zip code and the 3 surrounding, you know, zip codes get shut down for 3 weeks. Then people will start paying attention. Then people will start protecting their community. Okay, because if you don't want your business shut down, then you're going to enforce the mask mandate. You're going to enforce the you know, the health guidances, the public health guidances and recommendations. It's stuff like that. I mean, we guys much smarter than me are available for this work. I'm happy to help out here in Pennsylvania. I'm happy as soon as we win. Yes, my services will be on offer, and I will reach out to my network and the people that are going to be the public face of the CDC and NIH and FDA and all those candidates that are going to, you know, be selected either to be the head guy or the deputies and subordinates and the back office people. I know a lot of them. I know the names that are going to crop up, and I'm going to be one of those guys in the back that's willing and able to write the briefs and send them up the line for those approvals, because that's what I did when they were writing HITECH Act and Patient Protection Act. I was part of the Pennsylvania Healthcare Task Force under Governor Ed Rendell, and I worked with Joe Biden's team back then. Joe Biden was and Ted Kennedy were part of a federal task force that asked Ed Rendell and other Democratic governors to contribute so that they can, you know, form up a national policy on how to do electronic medical records and how to do population health and evidence-based medicine and what we need to invest in to get doctors to stop putting everything on pieces of paper, because we saw what happened during Hurricane Katrina. You know, hundreds of thousands of medical records ended up in the Gulf of Mexico. So
I do want to say that Texas has upgraded now their medical records to the Pony Express. So we're doing good there.
Yeah,
it's a big upgrade.
Good. Yeah, I mean, it's all there are guys that every year we have Health Information Management Systems Society conference, and it's 40,000 of us that get together every year, and we talk about um, like, what do you do with healthcare data? How do you, one aspect is securing it, one aspect is making it available to researchers, and one aspect is how to make it more available to the patients themselves to be participants in decision making, and how to mine it for evidence for comparative effectiveness and decision making and all this other stuff. But what evolves out of that is public policy. Like, how do you recommend to your state legislators or your senators and Congress people what investments need to be made on behalf of patients and their physicians to improve healthcare delivery in the United States? Something that we've been doing for, well, the society's been doing it for over 50 years. I've been at it for the last 20. And these are the experts that Mr. Trump has completely ignored. There has not been a single investment in health information management and the NIH, or they tried to cut the NIH budget at times by 12%, at times by 8%. The war on science is real, and the war on Christmas is fake. So, it's one of my discoveries.
No, I'm totally at war with Christmas. You're wrong there. It's just a poisonous commercialism.
It is.
Fuck all.
We're going to open up the floor here and go to group mode, I think, gallery view. Any more questions from Facebook Live or from our Zoom crowd here?
I think we're all up to date.
Okay, then let's open it up and get opinions. We can go round robin here. Terry, you want to start?
Oh, I'd like to get, since I've been mouthing off the whole time, let's get some people with the mics open here.
Okay.
Leslie?
Leslie, what are your thoughts? What do you think? Okay, I got two questions that I'll round robin everybody. Okay, so Leslie, you'll go first. What do you think is going to happen between now and the election, and then between the election and inauguration?
Oh, I don't even know.
So, do you have a prediction on who's going to win?
I think Biden.
Okay.
I mean, that's what I hope for. That's what I voted for.
Do you have any thoughts on? Well, I know, we all know that there's not going to be any significant improvement in the pandemic response between the end, the election and the inauguration. It's just going to be the same thing. What would you hope to see? And this is again to Leslie and everybody, anyone else that wants to chime in. What would you hope to see by June of 2021? Like, how would you want the country to feel by then, as a goal?
I just think it would be nice if everybody could feel safe. And maybe he actually does use the scientists and the doctors' opinions, the proper ones, not the retarded ones. And sorry.
Right.
And
that's my
and
girl
then maybe
right there.
and maybe by June we can all maybe be on a path to wellness.
Yeah. Don, you want to chime in? What do you hope for by June?
Waiting room, Sanjay.
Oh, we've got waiting room people?
Yeah, someone just messaged me.
Oh, Brian. Oh, Brian. Brian. What's up, man? Welcome.
Maybe by June.
Hey, Brian. What's up, man?
Hey, guys.
Wellness.
Yeah. So we were just hitting the last topic here, which is the election and post-election. Don, I posed the question to Don. What would he hope the country feels like by June?
And I'm glad to see Mr. Akers. Brian, is it? Yeah,
Yeah, I'm glad to see you here
excellent.
because the last time we saw each other, I think you chatted with me. Are you serious? About, and yeah, we've never left lockdown.
Yeah.
Yeah.
And some one of you crowd said, geez, if everybody was doing what you're doing, we wouldn't have this trouble.
That's true.
And
Even if they did it for a few weeks, 3-4 weeks.
yeah, well, we've been
It's
doing it
sneaky.
since a little before mid-March.
Yeah.
And we pulled my kid, my boy, who loves his class, who loves his public education, out of school and said, we're not sending you back.
Yeah.
And about 3 days later, the city of Virgins said, yeah, we're closing it down. And he loves hugs and he loves people and he's in public education, unlike my daughter who's homeschooled, because he loves the group that he's grown up with and he wants to be with them.
Yeah.
And he loves dogs and he loves cats. And today he was telling me, I want this to end. I want this to stop. I want to go back to where I was. I want hugs. I want to pet
Yeah.
dogs and cats. I want to be able to be myself with people.
Yeah.
And I am pissed.
Yeah.
Yeah.
Because you're right, Sanjay and Terry and all the rest of you, that had people taken this seriously, have we listened to the scientists, have we listened to the responsible politicians, we wouldn't be here now. And my kid wouldn't have this pain and I wouldn't have this pain because the apple don't fall far from the tree.
Yeah, absolutely.
And I am pissed.
Yeah.
So, I don't know what kind of shenanigans the Republicans will pull with the ballot boxes. I know what kind of shenanigans they've been pulling with voter suppression. So I'm not at all sanguine that this landslide that's building
Yeah.
is going to be successful. And I'm really worried. I've actually checked out. I'm not very far from the northern border. And I've checked out, I know that there are roads across that damn place. And
Yeah.
I got buddies up there. We've got buddies up there. And my ancestors did it centuries ago from the Pyrenees when Catholics were slitting their throats. They said, well, let's get out of here. This is unhealthy.
Oh yeah.
So anyhow, I'm pissed.
Yeah.
Yeah,
And
you're not the only one.
By June, we can hug.
So yeah, I hope so too. I will make one comment on the. I think we're going to see plenty of fuckery. Okay, there's going to be a lot of a mess on the election day and election night and the day afterwards. I don't have a lot of faith that the polls are accurate or that we're anywhere close to a landslide support for Biden, anything like that. It's still an uphill fight. We had, I keep mentioning that 85% chance of Hillary being elected on the morning of the election in 2016. That was the percentages from 538 and from New York Times. And, the averages across all averages were that she had an 85% chance of becoming president on the morning of the election. By 9:30 that night, I was calling it for Trump.
Yeah.
And I had a sister in Boston whose family on my brother-in-law's side had served in the Clinton White House and for 8 years and knew the Clintons intimately. And my sister attended Wellesley, graduated Wellesley, and went to BU Law. And so, she has met Hillary on many occasions. They had a election party at Wellesley that collapsed into tears on the night of the election in 2016 because all of the sisters of Wellesley were watching these results come in dumbfounded. And so I also have a little bit of a different experience here in Pennsylvania comparatively to 2016. I see a lot more support for Biden than I ever saw for Hillary. So, and a lot more activism and a lot more ground game. So I'm pretty confident, much more confident about Pennsylvania delivering for Biden than I am about Ohio or Wisconsin or Michigan or any of the others. So
Yeah, Ohio's a knife edge.
yeah,
It's
so
going to be super cool.
Arizona, Florida, all of that, those could go to Trump in a heartbeat. So we still have a lot of work to do in 2 weeks, and we have to get out the vote in a big way. And the young people who always are very enthusiastic about buying T-shirts and pins and
And then they never vote.
that never show up to vote, they need to show up. So but that's a big long preamble to what I wanted to say about what Don said. I still believe that no matter how badly Trump feels, he wants to feel powerful, that he can defy the results of the election if he loses, or that he could refuse to concede, or that there won't be a peaceful transition of power. He doesn't get to make that choice.
Right.
So I think that we have too strong a tradition in this country for him to have any effect. Will we have a night or a few days of unrest? Likely, if he loses. But the best thing for us to do as progressives and liberals and our leftist friends too, who I don't have much control over, that we don't get out in the streets and get in their faces. The best thing we can do if we win is to ignore them.
Yeah, they'll hate that more.
They will hate that more.
They will hate that way more than being in. They'll be like,
they
"We're
want the
here."
confrontation. They
Absolutely.
want it badly.
That's the Proud Boys game. They
Yeah.
want to force that confrontation, and when they don't get it,
Yeah.
it's way worse.
Yep. So let them stand out there with their dicks in their hand, and we'll just be home eating cake, But until then, we just got to get everybody. I said I talked to my pizza delivery kids, the boys and
Did you vote?
girls, yeah. I'm like, yeah. Are you registered? You going? Did you vote? What are you doing?
Yeah.
Everybody, the dry cleaning kids, and everybody under 25 is a kid to me now. So everybody is just, please make sure you're there, make sure you vote, and enthusiasm for those who had their fingers burnt in 2016 with the overconfidence that Hillary would win. I think there is a lot of remorse, so that that they didn't show up. So counting on that. You guys down in Texas, Leslie and Terry, apparently 20% or 25% of your electorate has already early voted.
Early voted and mail-in voting.
Huge.
There's a little history lesson here, and I was reading about this. Hillary peaked polling-wise on October 18th, 2016. And at about the same time, she stopped making personal appearances in Rust Belt states, even though people on the ground were telling her there was a big problem and she needed to show up. And she was already not a well-liked candidate. So that was the tsunami that took her down.
Yeah.
And right now, we're not duplicating that numerically in a lot of states that Biden needs to carry to win. So there's some positive there.
Yeah. I think there's a lot of, it's weird. You can't get, I don't know who these undecideds are. Honestly, I don't get undecided.
I know no undecided voters. Out of every single person I know, everybody knows who they're voting for. I don't know a single one.
I know that I can't get through to some Trump voters. I mean, all Trump voters. The people who are true Trump cultists, they're beyond reason. There's no way. There's no point even trying to engage them or talk to them or convince them. There's nothing you can say to change their mind. There's no evidence, no data, nothing. And David has been our whisperer on the reasons of why certain people, you know, are like that. And we even had Dr. Racimus come and talk to us about how those of us on the left can be equally dogmatic about our beliefs, even in the face of being shown evidence to the contrary. So we tend to believe that we're right and they're wrong, and they I don't know what the hell they believe. I can't get in their head. I don't think I want to be in their head, but morally we're definitely not wrong about our approach to this pandemic, our behavior, our faith, not faith, our trust that the science is trying to lead us towards safety and away from risk. You know, and that this is political is unbelievable. That masks are political is truly astounding. Astounding. You know, every once in a while I'll find a deal on Facebook off of somebody selling something, you know, an emergency sale or whatever. People are out of work and it's awful. And a former patient of my mom's is a chess teacher, expert, whatever you want to call it. My boys are learning chess. So I bought a couple of beautiful chess sets off of him. He has a former liver transplant, and you know, he highly protected mask and everything like that. When I met him, I kept distance and all of that stuff. He knows that I'm a physician, but his wife was very worried because it was the first time he had come out in public. We met in an open space and all this stuff, all these precautions, but he was so excited to show off his chess set. And I was the one giving him wide berth and distance and all that stuff, you know? And then I had that experience with him because I know he's on immune suppressive medication as a result of the liver transplant as well, right? Had that experience. Later that day, I purchased a piece of electronics from a obvious Trump supporter. Okay. He could not keep his mask on for more than a minute. I was like, I don't believe in this. And then he just kind of, nice guy. Okay. But the difference in attitude was so stark. He's like, oh, I saw the Biden sticker on your car. I'm like, here we go. And I'm like, yep. And I'm a doctor as well, so I'm gonna keep this mask on.
Oh yeah.
And, you know, but he's just taken off his. It looked like he was wearing an Eagles fan, whatever, and wearing an Eagles mask, and it looked like he hadn't been washed since the beginning of the pandemic.
There was a guy at my daughter's soccer game, and I seriously wanted to tackle him and just beat him down, even without the pandemic.
Yeah.
You know, but he was no mask the whole time. You know, you're supposed to be wearing a mask on the sidelines, but maybe 50% of the people do. But not only was he not wearing a mask, but he walked up and down the sidelines the entire time, screaming, fist bumping people.
Oh.
And I'm just like, you know, it's just, when do you have a tranquilizer gun and a perfect chance to use it? You know, it was terrible, you know, and I don't know, people were interacting with him and whatnot. He was doing it with people he knew. So I think they were from the other team because I've not seen him before. You know, but it's interesting to see that dichotomy. You know,
it is. Up. And I think we talked about it last time that I can predict a conspiracy theory emerging because like you'll hear about it on Fox News or something will be out there, and then within hours, every Trump supporter is parroting the exact same thing.
It's all over.
Okay, so if I'm just we already had anti-Fauci hate. We already had him blamed for shutting down the economy and the destruction of small businesses and et cetera, the economy. So we had the Fire Fauci hashtag and all that stuff. Now with him calling him an idiot and saying that he's been around for 500 years and he doesn't know what he's talking about, and if it were up to him, blah, 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 millions more would be dead. It's such a heinous accusation, and it will be parroted immediately.
Absolutely.
It will be parroted.
On the DeWine, it's all over the DeWine post today.
So, and then now there's an even greater danger to him and his family, because we know that we had a bunch of idiots in Michigan trying to kidnap the governor, and it's only and
their intent was to murder her.
And and it's a direct line from him tweeting "Liberate Michigan" to these idiots. There's no like squiggly line. It's a direct line. And the same thing now for targeting scientists and Fauci as the face of the scientific community, the biomedical community, and its response, its evidence-based response to the pandemic. So with Fauci's face out there as a target,
absolutely,
it's heinous. It's so disgusting.
And that group of conspirators, they met in my hometown where I live. So they came from Michigan and they met here with a guy in Dublin, Ohio.
That's right.
Planning you can see it in the FBI write-up. Because I read through the whole thing and I'm like, they came to Dublin, Ohio.
Yeah.
I'm like, you've got to be kidding me. And I do want to bring up one thing that touches on this as well. So Dublin City Schools, the word on the street was October 21st, they were going to go full 100% attendance 5 days a week. They didn't do that. However, the reasoning behind it came out because the director of the Dublin City Schools is getting death threats. And they have a 25 doctor panel where they get advice from these doctors and try and figure out, what they all think and take in, their reasoning. 10 of them quit because they stopped listening to those 10. Because those 10 kept advising, stay in hybrid mode, keep a population, the people who want to do distance learning, keep them doing that. That's where we need to be right now. And so they all resigned because they were basically being shut out. So it's not just at that governor level, but this all trickles down. I'm sure other places are experiencing this as well, but that's our local area.
Oh, Wisconsin. Catherine Wilson's here. Catherine, how's Colorado faring? I think she might not be with us anymore.
Hi, we're going up.
Hey, you're going up?
We're going up.
Crap. Has it started getting cold? Ski season starting yet?
We've had 2 major snowstorms
already. Holy.
Yeah. It's nice now. It's mellow, but we're expecting another one.
And now things are open and people are going to start moving in.
We've been, the governor's been on telling everyone to buckle down, that we're getting into a hard period and numbers are going up and hospitalizations are going up. He's trying to, and there's a lot of hostility towards that.
Yeah.
And where I am, I'm kind of on the cusp of, I don't know how to say it, but like the educated and the non-educated. Right. So I've got a mix of Trump and Biden signs and stuff where I live. We're also a resort town, right? So right now or valley, I should say. And so right now we call it mud season. We've got one in the spring, one in the autumn, and that's when the leaves are down. It's not so pretty. The snow isn't here yet. Yeah. So the tourists are gone. So it's basically locals here now.
And when will you start getting tourists?
We open November 20th.
Okay.
And I've signed up, to work. So, it's outdoor work. I work outdoors, but it's a little, and I've had, I have clients from all over the world. Obviously, the ones who are not in this country are not coming, but I've had clients from different parts of the country and some of them are physician couples and stuff, and, who are going to come with their family. Like, they've already have me set aside like 3 times this winter. However, it's really, it's still tentative, I mean, a lot of people, I had a couple from Mexico who just canceled because the father from Mexico City tested positive, but he's asymptomatic.
Yeah.
And so that kind of clued them into the real seriousness of this. They have been very protective about themselves in Mexico City.
Right.
But, we get people from a lot of different places who come here. And we get a lot of people from Texas and places where people are not as prone to be wearing masks and things. But we have a very strict format that people have to follow if they come here.
Well, that's
now.
good.
So
that's good.
I'm just worried about the locker rooms stuff.
Yeah. Now, do you have the resorts invested in high flow or HEPA HVAC?
The town bus has. The town bus system has.
Good.
And I actually wrote them letters saying, this is what you should be considering for the locker rooms, and also to use, like, they won't be opening up a lot of the restaurants, so why can't we, extend locker rooms into those spaces to spread people out more?
Right.
So, right now we don't really know what's happening. We've had a huge shakeup in management because they were down like 68% because of closing last spring and for bookings this winter and everything. So they've consolidated a lot of positions and eliminated a lot of positions. So it's going to be a very, very different year.
Okay. So I wanted to announce, I guess, 2 things, 3 in the end. So the first thing I'm announcing is next month's topic is long COVID. So we're going to have hopefully a guest from Mount Sinai. Their long COVID center will be joining us, as well as information on the actual molecular biology and immunology behind the derangements that are seen in the endothelium and the other microvascular structures that may most likely be targets of the autoimmune response in long COVID. And then very, very little in terms of therapy has been put forward to help these patients. So between now and then, I'll be researching the preprint publications to see if anybody has been working on the problem of treatment of long COVID, as well as the regarding long COVID. There was one other thing that I wanted to say. Anyway, it just escapes me, but yeah. So next month our focus is going to be on long COVID, and we'll have a physician that is working in the Mount Sinai Long COVID Center, and then we'll probably review some papers as well and present them here. If anybody has any topics that they want me to cover for next month, please go ahead and submit them on the resource page. Just send them to Terry or me through Messenger or on the page. And then the other announcement is we are doing a election night watch party. So I'll have a setup here in my office. The big screen over here will have the election board. And then, there'll be a camera off of my iPad, off the laptop, and it'll be like Sanjay's, John King on CNN. It'll be Sanjay's little cockpit for the for the election. And also,
are you doing the hologram this year?
No, that was the thing. No hologram. No holograms. So that's the only thing John will have that I don't have. So that'll be fun. And then we're still getting organized because of the absolute madness of having my daughter in college, my mom moving back to the Boston area from Florida, these boys now, back in school, and all kinds of other stuff. Terry and I, mostly my fault, have been unable to record our first podcast. So we're hopeful that we will get that launched, and then we'll make the announcement on both of our pages as well as the other page. Again, it's a much broader topic list than COVID, but both of our life experiences, and internet findings, and society and culture and healthcare and all that stuff. So stay tuned for that. And those are the end of my announcements. If there's anything anyone else wants to say or any questions that I've left.
Visit Sanjay's YouTube page.
Yeah.
Visit your YouTube page.
Yeah, please. QAnon has like 700, had a stupid video and had like 700,000 views. And I have like a couple hundred views.
Listen to an old COVID cast today while I was working.
Yeah, it was good.
Yeah, it's good stuff. And listen to some of the ones that you broke out. I think your recent ones you broke out on the site.
Yes.
You had some like 18-minute ones. I watched some of them. Listen to some of those too.
Cool.
Hey,
I would just say,
well, go ahead, man. Sorry,
I was going to say, I included the links to the Nature article I've referenced in my previous comments. So if you haven't looked at the chat and you scroll up, I included everything. But then also I included 2 links about how to fight that. And I just wanted to include that because there is hope. That's what I wanted to add.
Thank you.
Dave, this is a weird place to have references to stuff, and links and facts. It's very strange.
That's right.
So I wanted to say our next monthly meeting is going to be after the election.
Yes.
And we're going to need to focus after all this silliness dies down a little bit. I really believe in my bones what's coming with COVID is going to be so ugly. And I'd like you all to protect yourself and your families. Pretend this is March of 2020. Pretend it, get your mind back where you were, 8 months ago. Every little thing you did, because if we go historically by what the second wave was back in 1918, we're looking at a real shit show coming our way. Yeah, and this is going to be something that even the deniers are going to have to stop breathing the bullshit about.
Yep.
So some of them will.
I hope.
Because I've actually seen some of the hardcore, Trumpians I work with alter their attitudes on some things. Because
that's good to hear.
I mean, they don't even believe the numbers in Texas, and Texas is as Trumpy as you can get. Yeah. And I really think in a month we're going to see that line is going to be as far south as Arkansas across the country.
Yep.
So, and everything above that is going to be hot red.
Yep.
And it's going to be kids out of school again, businesses shutting down, and people dying. So take care of yourselves and your loved ones. That's what I got to say.
Absolutely, I agree. 100%, Terry.
Amen.
Okay.
I have a question.
Yes, please go ahead.
Okay, so let's say Joe Biden wins, and when he gets inaugurated on January 20th, do you feel that he is going to have to mandate mask wearing? And what would be the penalties if people didn't do that?
It's a great question. So one of the things that I think I strongly suggest is that I don't think there is unless something drastic is done like martial law, there is no constitutional mandate or legal basis for him to be allowed to issue a national mask mandate. So what he will have to do is issue a national strategy and then get all of the governors to sign on to it. So like the first 10 days of his forget about the first 100 days. The first 10 days of his presidency has to include a summit for all of the governors. And they have to come together, and all of them have to be asked to sign a national strategy pledge for implementation. And so that national strategy pledge for implementation would be, whatever legal problems may exist, whatever challenges may be brought forward to their Supreme Courts, they will stand in front of their courthouses, in front of their capitals, and say, for the next 3 months, there is an absolute mandatory mask usage in our state. And here are the circumstances where non-compliance will result in a fine. Okay, mass non-compliance may result in not only a fine, repetitive non-compliance, it may result in a fine and a jail time. We're going to have to get that serious about it. And so, we need to defeat we used to call it, what was it? Objection. No, I can't remember.
I always called it a pain threshold.
Yeah, it is. We used to call it anticipation of objection. So like you can already anticipate any president, whether Republican or Democrat, getting in front of the country and saying, everybody's going to have to wear a mask. Okay, there will be so many legal challenges to his authority to do so. If you break that down to the state level, and you get the states somehow, like Terry said, there has to be a carrot and stick for these states. So even the reddest of the red states with the reddest of the dumbass governors would have a incentive to ensure that they meet the numbers, okay, on percentage positive and on cases per thousand and on hospitalizations. And then one of the ways they do that is, that you get to reopen your economy if and only if those targets are met. And then, it has to be in compliance with public health recommendations from the CDC and NIH, which then will be staffed by competent, scientists and physicians, and not lackeys.
Not
so that's what I would recommend as a strategy to his transition team. Each in the transition team is a core overarching umbrella of transition elements for the White House executive group, the cabinet, etc. But under them are policy czars, what you would call policy czars across all of the departments. So from state to Health and Human Services to transportation to energy, there will be the guys that end up being the right hand and left hand of all of the cabinet members once they're selected. Their work begins the night of the election. So once the winner is announced, their work begins immediately, and I intend to be there. So on the healthcare and Health and Human Services group. So I'll be helping people make those recommendations.
Okay, a follow-up question.
Mm-hmm.
Say Biden loses and Trump gets in.
Mm-hmm.
However, we flip the Senate,
yeah,
and we still have a majority in the Congress.
Mm-hmm.
Having that many Democrats in Congress, would they be able to implement these necessary steps to end the pandemic without Trump's input?
I wish I had, a recent friendship has formed between me and a gentleman from the West Coast named Doug Wolf. And we have been talking about a lot of constitutional issues and things like that. And he has some legal friends, legal scholars and legal professional friends who he tosses these questions to, and they give, educated answers. I can't give you an educated answer on that question, although it's an excellent question. I believe that the president sets the tone and sets a, you know, a kind of the leadership comes from the executive branch in terms of the direction of the nation.
Or the lack thereof.
Or the lack thereof, or the lack thereof. So if he is reelected, then I'm going to have to lean on the cynicism provided by my best friend here, Terry. No good can come of that.
And even if they take the Senate, you need 60 to override a veto. He will veto every single thing sent to him. So what Mitch McConnell did to the Democrats in the House, it'll just flow up to him, and everything will go right back to Congress.
Yeah, he doesn't have any convictions whatsoever. So that's the main problem. So there's very little that the Congress can do to set the tone for a pandemic response. It has to come from the departments in the executive. That means NIH, Health and Human Services, all of the divisions that are under the health secretary. And the health secretary is a dickhead. So, you know, he's a lackey, and
that's Azar, right?
It's Azar.
Yeah. So what our Congress has failed to do for the last 4 years is to use the budget
to wrangle him in.
Yeah, and they've completely failed at that.
Yeah.
Every year, every budget, they've failed at it. And for all they talk about being the resistance and holding the line, all garbage, all talk.
Yeah. So
they could try something like that. I think that's the one thing they could do, but I don't think they'll do it.
Yeah, there is a power in, for example, what LBJ used to do. You know, you have to give him the Johnson treatment. You know, there's going to be a carrot. There's going to be a big fucking stick. All right, and so take the carrot. It's going to be in your benefit. If Biden gets elected, he's going to be handing out carrots. Take them. That's what you got to tell the Republican governors. So anyway, I love you all, and I'm glad to see your healthy, somewhat happy faces. And I hope that continues into November. Please listen to what Terry said. Please, take care of yourselves and your friends and family. I see Madeline's beautiful face over there on her 2019 iPad. So with that, I leave you all, bid you all good night, and we'll keep you posted about the upcoming events. Okay?
Okay.
Okay, thank you.
2 more weeks.
See ya.
Thank you, Sanjay.
Very welcome.
Bye-bye.
Good night. Bye.
Good night.
Good night.